Hi, and welcome to Nothing is Rocket Science, a podcast where we discuss the nuances of science behind everything. I'm Sandhya Shekhar, and we have with us today Professor James Kundart, um, who's going to be talking to us about vision sciences, about the relationship between light and our environment and our perception. So, Professor Dr. Kundart received his Bachelor of Science in Astronomy and Astrophysics and Bachelor of Arts in History from Pennsylvania State University. He matriculated from Pacific University with a doctorate in optometry and also a master's of education. He's now the faculty of College of Optometry in Pacific University, where he teaches visual perception, ocular motility, nutritional optometry, and pediatric ocular diseases. He is also currently pursuing his PhD, and he is studying the relationship between retinal structures and image size difference. Let's not get into too much about this. And to add to this, Professor Kundart is also my teacher for pretty much every semester of my grad school, I guess. So we go back a long time. So welcome, Dr. Kundart. It's great to have you on this podcast, and thank you for giving us your time.
Thank you for inviting me, Sanja, and also for finding a time with our time zone differences that this could work out.
Yes. So to start off with, I do have a couple of questions that people I know reached out and they said that these are something that we want to learn too. So I put together a few questions and also added a few topics that would be interesting that uh, a, a lot of people are talking about this these days, and it'll be great to add a few more points so that people understand it easily. So the first one would be, we are in the peak of winter right now, so the days are shorter and the nights are longer. So and even with the shorter days, we also have overcast or gray skies. So this affects our mood and our overall attitude and our overall behavior. So can you tell us the effect of light on our mood and our behavior patterns, and more like if you could concentrate on how our brain and eyes play an important role in maintaining this equilibrium?
I'm glad to do that. And maybe I can, as you know, I have very many slides and pictures on this, and maybe I can illustrate it a bit if I
Right.
can quickly share my screen. Although I think you'll have to allow me to do that. So I'll start by talking and then let you allow screen share since you have total control. But
Right.
yeah, so you're getting at seasonal affective disorder, and I think there's been a great increase in knowledge about this condition outside of psychology since I was a student in the 90s. And I think that we now understand that lighting and color of lighting matters with regard to this. So let's see if I can just put up one picture, and I promise not to give you my whole lecture on this, but I think this is the kind of thing I might have
Right.
shown in class with full. This is, of course, an open source picture from Wikipedia that we should be fair to use here. But we do know that the average person, the way we control our circadian rhythms, which happen in various organs of the body, but in terms of these circadian rhythms of the brain that help us to wake up and go to sleep, it has to do with light exposure. There is a third eye, and it is the pineal gland, which is buried deep behind the midbrain, and it is connected through about 20% of the optic nerve fibers to the actual retina in the eyes. And it responds to a certain wavelength of blue light. We think it's around 480 nanometers for people who are keeping track of those things. It's a high wavelength blue light. It's not very different from the color of this blue head they're showing here. That kind of blue is what you're looking at. And that aspect of when white light being made up of all the colors of the rainbow, that aspect of white light is what is supposed to wake us up in the morning. It's easy for many of us if you're in the northern latitudes and the summer days are long and the sun comes up before 6 a.m. There's often a lot of sunlight, and therefore a lot of the blue wavelengths that can help stop the melatonin hormone that is the sleep hormone. And when you're exposed to blue light in the morning, it helps you naturally wake up even through your eyelids when you're sleeping, if it's coming in through the window and you don't have blackout drapes on the curtains or that kind of thing. So In the wintertime, however, especially in the northern latitudes, and there you are in Boston, and we're out here in the Portland, Oregon area. The sun might not be up when you leave at 7 a.m.
Right,
And so,
right,
unless you have artificial blue lighting, you may have melatonin in your bloodstream upon when your alarm clock goes off, and it in some folks it makes you feel grumpy, maybe angry. Others it makes depressed, and it certainly makes you feel less active because the melatonin hormone, at whatever low level, is telling your body to stay asleep, and you're trying to wake up and be active. So that's the role it plays, and you can see here there's another element. The suprachiasmatic nucleus is the actual biological clock, with the pineal gland that releases the melatonin being the synchronizer of that clock. They've even discovered since the 90s or so, a photoreceptor in the outer layers. I guess, well, we should say the closer to the vitreous, the inner layers of the retina, and the ganglion cells that can respond to this blue light. We're not conscious of vision of our third eye, of our pineal gland, but it definitely affects our mood. And so I'll stop my screen share now so you can see each other better. But that's the that's known to be the element. So there are people that will take. Sometimes it's interesting to know that you can learn more about seasonal affective disorder if you know that it happens in the summer to some people, and in the summer in either hemisphere, some people who can't get to sleep at night
right,
have depression during the short summer nights. And for those people, there's an easy, in the US, an easy over-the-counter fix where they would take melatonin supplement a couple hours before they want to fall asleep, maybe at 9
right,
p.m. or something, and that would help them sleep. And so that, for summer SAD, that would be a good treatment. But for winter SAD, the blue light treatment is probably the best, although the average consumer knows about, and I think psychologists too, knows about the light box. That's a 10,000 lux full spectrum or wide spectrum artificial light. It's really the blue element of that that's helping. But
right.
if you want to have the full spectrum light, that's fine too.
Okay, so it's melatonin that is keeping us, that's putting us to sleep. Does that mean that melatonin is secreted towards the end of the day, so that that's making us sleepy, or that's making us not concentrate on a lot of activity and slowing our system so that we go to sleep?
That's the idea, and
Right,
that was, of course, that system pre-exists artificial lighting, and
right,
artificial lighting can mess up melatonin release by suppressing it at night,
right.
and in the winter, if you don't have the lighting, it can cause it to flow too actively in the morning.
In the morning. Okay. So yeah. Talking of melatonin, there are other hormones, I think, which are closely related to this particular process. So if you can tell us the roles of melatonin, melanopsin, serotonin, and dopamine, because I think they go hand in hand. So if you can
That's
explain to
true.
us.
Yeah, that's absolutely true. So, well, melanopsin is the photopigment. So that one among the group has a different suffix, and the opsins are not hormones per se, but they are the biological proteins that absorb light, and
Right.
they're generally tuned to a favorite wavelength. In the case of, we've all heard of things like maybe rhodopsin, which is the photopigment that we use to see at nighttime. It's in the rod photoreceptors in that layer of the eye, and they are tuned to a mostly green, a bluish green light. But the melanopsin in closer into the center of the eye, a little bit, are tuned to that blue light, and that's what communicates. The melanopsin communicates with the melatonin release, and so
Right.
they're well named to communicate with this. So melatonin is the sleep hormone, amazingly available over the counter in the U.S. And melanopsin is the one that tells it to either turn on when there's not enough blue light,
Right.
presumably at night, and to turn off in the morning if there is blue light. Now serotonin is you mentioned as well. That, of course, is a hormone we often need to feel good.
Right.
Some people who suffer from substance abuse get addicted to the release of that hormone, but it is tied to daytime activity,
Right.
so waking activity. And if you're a night owl, as I am, you might have serotonin also when there isn't light. So it's not always tied to that. There are different psychological states that serotonin, some would argue, cause, and maybe it's a feedback loop that you can if you are in that psychological state, more serotonin is released. And those of us that get in the zone, as we call it, whether it's through physical exercise or mental exercise,
Right.
you felt the serotonin release when you felt very, very active and productive and that kind of thing.
Right.
Dopamine, on the other hand, it's interesting. Dopamine is found in some foods. You can find it in bananas, for example. We think of
Okay.
potassium with bananas, but dopamine, in at least one of its forms, is available in bananas. And that might not be an accident. Bananas, of course, grown in tropical regions of the world where there's a lot of sunlight. Humans
Right.
get dopamine also through sunlight exposure, and there's some evidence that dopamine is a way to slow down myopia progression. Um,
Right.
and thus the recent advice that if you have a growing child, say between ages, I don't know, 6, 7, 8, and 9, up till teenage years, that you might want to encourage them to spend more time outside if possible in the sunshine. Now, the problem with that is not all children have access to safe outdoor areas. Not all area, if you're in the desert Southwest of the United States, if you're in Phoenix, it's too hot to go outside in the summer.
Right.
Other places it might be too cold during a lot of the year, like where you and I are right now. So then I don't know. Do we encourage our children to get the tropical fruits like the bananas, eat those to
Right.
slow the myopia? I don't think there've been studies on that. Or do we actually want to prescribe the hormone? Which I think you have to be a little cautious there. But that's the interest. There's definitely, it's not surprising there's a relationship between refractive error and light exposure, but it gets a little more tricky when you look into the hormonal connections.
Right. Right. So, and do all of these hormones and do they get activated in the presence of light and sunlight specifically?
Yeah, you could say that, but it would be a little simplistic. If you remember the summer sad that we talked about, the person who can't might be living in a sunny place, maybe closer to the equator, or even at the northern latitudes where the days are very long in the summer, and they can't fall asleep at night, and they don't like being a night owl. Then we call it
Right.
insomnia, right?
Right.
And insomnia can be very frustrating, of course, if you're not happy being up at night. And
Right.
so in that case, the exposure to sunlight and presumably the dopamine and such that comes with it is not making them happy. Right?
Right.
So
Okay.
yeah, so it is a little bit more complex, and I think you have to look at the environment that if you're a doctor like we are practicing in a certain latitude, you have to look at what's around you. Even in
Right.
Oregon, we have a dry side and a wet side. Portland is rainy, but you go out to the other side of the Cascade Mountain Range in Bend,
Right.
Oregon, or something. It's dry and sunny a lot of even in the winter. So that's going to change how your patients react to these light-induced hormones.
Okay, that's interesting. Um, and right, so the next question. So, when we say light, is it only sunlight, or there's any other light that is important for the behavior or performing of other activities? Like, for example, especially with COVID, most of us are restricted indoors, so like going out is not possible on all days. So in that particular situation where I do need a good dose of sunlight, because I myself see that I'm a little more lethargic on overcast days, because it's just like I don't feel like concentrating on my work. So in that kind of a situation, if I increase my lighting indoors, would that affect my performance, or would that activate my circadian rhythms? Would that activate my melanopsin to stop secreting melatonin so that I'm much more active?
Well, that's the idea, is that the indoor lighting would replace what is missing in the winter in the northern hemisphere, for example,
Right.
at northern latitudes. Maybe I can do one more share of some uh, color temperatures here, and let's see if we
Yeah.
can bring this up a bit. Um,
Yes.
so we live in an age, at least in North America, of having access to many different forms of artificial lighting.
Right.
You can't control some of it. We're fortunate to, of course, I think the cities have discovered since whale oil lamps in the Northeast where you are, that lighting up the streets at night can provide safety as well as mood effects for the large urban areas of, for example, the United States. But you might be noticing our now long electric street lights have changed their color in recent years. As we've switched to more environmentally friendly LED lights, they've
Mm,
moved up in color temperature. And here I'm missing the sodium vapor lights, which were kind of that orangey pink salmon color, coral
right.
color, and we've moved
Mm,
to this almost harsh bluish white light. It's very
right.
effective, and I applaud the environmental carbon footprint of these light bulbs, both in their production and in their use. I really wish we would filter them, however, because there have been some reports that senior citizens who have trouble sleeping often anyway, due to factors that change with melatonin release with age, if they have these LED street lamps outside their bedroom window and without blackout curtains, it's sometimes causing them not to get enough melatonin at night, and they're having trouble sleeping despite perhaps lower use of digital displays. So
Okay.
I think the best of all worlds would be to use the LED light and find a way to filter the bulb basically, or the lamp with a lower, warmer looking color temperature. The people who work in lighting in hardware stores and things, they always ask people, why don't you like these lights? They have everything going for them. Maybe they're a little more expensive for the bulb, but it pays for itself over its lifetime. And people
Right.
say it's too bright. These kind of harsh lights are
Mm,
too bright. What we need to know, I think, is that the perfect color temperature that we're evolved or adapted to is the color temperature of the surface of the sun, which is around 6,800 Kelvin.
right.
And you can get that in an LED, but you want to be careful not to go too high or too low. Our
Right.
incandescent lights that we like at home for falling asleep at night, they're
Right.
not very energy efficient, good for heating the house, but but they have the low color temperatures. Fluorescents are kind of in the mid range. LEDs tend to be really high, and so finding a truly full spectrum artificial light that would help our mood is can be done, but you need to look. In the U.S., we label the light bulbs with the color temperature,
Right.
regardless of where they were manufactured, and you want to look for something around the 6 to 7,000 Kelvin range.
Right.
Assuming you want to wake up in the morning, maybe at night you want to go a little lower to the and
Right.
the beauty is, my kid has a desk lamp that you can change the color temperature on from day to night setting. When you want to be
Right.
productive during distance learning, you can have it bluish white and then make it warmer white for nighttime.
Right. So like you said, we could probably use the white light during daytime because it keeps you active and you're not lethargic or facing a lull. But towards once you're done with work, you're relaxing and watching maybe Netflix, I don't know, or doing any sort of thing. Probably we could shift to warmer lights, so that our we're much more I think it's easy to fall asleep in that kind of a lighting condition and you're much more
Yeah.
comfortable.
Yes, and of course, there's been a lot of interest in the digital display effect. Those of us that switch,
Yes.
especially when we're staying home all day, we switch from our desktop laptop to our iPad or phone,
Right.
and then if you're like me, you take off your glasses, you're going to bed at night with your nearsightedness, the phone right in your face,
Right.
and
Right.
falling
Yeah.
asleep on the screen. There are concerns, of course, that you may be causing cancerous mutations. Some of us are so addicted that we would feel that's almost worth it. But uh, but of course, the companies have answered that with having the iFlux filters or the night shift filter on Apple devices that at a time that you can set
Right.
around sundown, it puts everything yellow. I know if I reset my phone in the middle of the night and before that filter comes back on, it is harsh. It's at
Right.
any brightness that you can see the blue, and that will be stopping melatonin release. So if you can't change the lighting around you, if you're not in control of that, maybe it's embedded in your ceiling and you rent your apartment and you can't, or same way at work, you can wear a filter that is the blue blocking filter that becomes so
Yeah, we're going to
popular.
talk about that. Yeah, we're
Yeah,
going to
yeah.
talk about that very short. Um, yeah, like talking about the screens and our phones, because we're either on computer or laptop or on a phone continuously. So in addition to the lights, is there any merit in changing the filters on phones, like you discussed, like for example, towards the end of the day, or like when you're going to bed, you're definitely going to spend about half an hour to 45 minutes looking at your phone, or like you just open a video on YouTube and you're on a loop, you keep watching that video after video. So in that case, is there any merit in reducing or like switching on the night mode so that that's the bright light, I think, is reduced when you switch on to the night mode, I guess.
Yeah, there is if you're looking to sleep. If you're cramming for a final exam and you want to stay awake, then you should
Right.
not do that.
Right.
Or if you have another project deadline or that sort of thing. Certainly, one would not want to be wearing blue blockers for driving late at night where you might fall asleep at the wheel or something terrible. So I think the myopia control community among eye care practitioners would say also you don't want to be blocking blue light
Exactly.
for a growing youngster who's developing myopia, at least not during the day. So
Right.
where, I know that since the COVID restrictions and distance learning here in the US, when I do eye exams on children, like yesterday, many of the children where we are had a in-service day for their teachers. They were off school, so they came in to get their eye exams. And it's very common to have parents say they're on the screen all the time. Let's get a blue blocker, even though we have to pay
Right.
extra for it. And
Right.
you're looking at their prescription, and if they're if they're a hyperope, maybe they want to get rid of that hyperopia if they can. Then okay. I do think that there are a lot of those filter. If you can't see the filtration on your screen, you can't see the yellow tint. Same as with glasses, then you're not going to probably get much of a benefit from it. But yeah, if you're trying to fall asleep at night, absolutely. I think that is the most proven thing, more than any of the claims about preventing macular degeneration or even the claims about reducing digital eye strain. I think those
Right.
are much less proven than the effects on melatonin release.
Okay. So, right. So it's better to avoid blue blockers, especially for kids, so that the good effects, the benefits of blue light is, it doesn't stop the benefit of blue light.
Well, I would think a kid that's got concerning myopia development, or a kid that needs to stay awake and is falling asleep up there. Some of them are doing 6 hours a day on Zoom from
Right.
kindergarten to 1st grade, and you don't want. It's probably not human nature to do that at that age. But
Right.
those kids, I would say avoid the blue blocker. But if I have a 10-year-old at home, and if I don't put the time restriction on his iPad, he'll be staring at that thing till after midnight on a school night.
Right.
And so
Right.
I absolutely want it on, and if I have him, he has a rule, he can read books in bed with a flashlight, but only paper or hard copy with
Right.
a nice warm color temperature flash, not the backlit display that will be more likely to keep him awake.
Okay.
That's been discovered a long time, but reading a book is a great way to clear your mind and fall asleep, but maybe
Yes.
not on a backlit Kindle, maybe
Yeah.
on a paperwhite.
Paperwhite. Yeah.
Yeah.
Okay. Yeah. That's interesting.
I can probably share, if I can find it here, a little bit about the satellite that's all made of blue LEDs.
Right. Sure.
That and again, we are required to say, although whenever I'm giving a lecture, whether I have vested financial interest in, I do not. I'm a full-time professor on no commission from anybody. I do not lecture for industry. But with so some of these, when I show a product or something, it's sometimes not one I've tried out myself. But let's see if I can show you a little bit. The question of using the light to wake up might be better addressed if you're thinking about should I have an alarm clock that most of us use our phone, but should I have one that uses some kind of LED array? And if so, do I need the light box that you're supposed to sit in front of from breakfast? I know that I prescribe those, and many psychologists in the U.S. prescribe those. The light box, though, may not, again, be with LEDs. You're not wasting a lot of electricity. It's not a high intensity thing, but it might just be the blue element of that really is doing you some good. I might have to wait a minute for this to come down off the iCloud, but
Okay.
but
No
I was going to say there are digital dedicated alarm clocks like we used to use that use just a blue LED array that will come on. Instead of using a noisy alarm clock, you use a blue light that would, if you're sleeping a certain way, that it will face towards your face through your closed eyelids and be the effect that sunlight would have to naturally wake you up slowly. You want that to come on maybe an hour before you're to wake up, and slowly wake you up the way I do with my kid when there is sunny light in the morning here in Oregon. And I open the curtains to wake him up rather than startling him.
Right.
That's the way human beings are wired to operate. So I apologize if I can't bring the picture up right now, but that's I think what I would encourage people to look for who are affected by SAD, winter SAD.
Right. So like you said, the blue light, it's artificially available. And if there's a way, if there's a way that we want to get it naturally, so walking outdoors and being outdoors is one way to naturally get it from, from the sunlight, I guess.
That's true, and I would encourage that. I found a picture for you outside my PowerPoint that
Mm.
maybe will help a little bit. This is the kind of device you can. This person's probably not sleeping at their laptop, but probably would put that next to their laptop in the morning when they want to
Okay.
wake up. Not at night, unless you want to stay up and cram for a final exam or otherwise get a
All right.
project. Yeah, but sunlight is great if you can get it. I think I've met patients that have grown up closer to the equator as perhaps you did, and they find when they go back home to visit that their mood changes completely compared to
Right.
then coming back to the cloudy winter in Oregon. So a winter vacation back when we could do such things pre-COVID, maybe there will be a time again that might also do the body a lot of good. There is probably a vitamin D connection as well, as you may
Right.
know. Vitamin D is found in very few foods unless you eat fish or some mushrooms. You have to get that hormone from sunlight, and it's
Right.
it's kind of a steroid hormone. And the more melanin you have in your skin, the more sunlight exposure you would need. So if you to get the same amount of vitamin D, so if you move north and you have a lot of melanin, you almost have to supplement with vitamin D
Right.
unless you're really immune to the cold and you can expose your arms and your face to the
Yeah.
sunlight in the winter.
And especially now with the climate being really cold, so I mean I can't walk out without a proper jacket and a mask nowadays, and a hat probably. So is there like walking in the sun, like taking a walk especially in the mornings, with like with a totally padded coat, does our skin still absorb the vitamin D that is required on
Well,
a daily basis?
in the northeastern United States or the Northwest where I am, that there's probably not as much absorption as you would like if you're
Right.
not very pale like I am, And so,
Hmm.
frankly, the pale people, of course, if the sun gets at any level of intensity, I mean, I can sunburn in the springtime, so I
Right.
avoid it. Uh, there, there's good reasons for Caucasian folks in particular to wear sunblock to avoid skin cancer. I would say that having more melatonin is better adapted to the general climate change we're feeling around the world.
Mhm.
But yeah, I'm not sure we can get enough vitamin D with a winter walk. There are other reasons to do it. It may get serotonin flowing and things.
Right.
There there,
Yeah.
there are many antidepressive effects of exercise, but I'm not sure that it's better than being indoors with a blue light or with a wide spectrum light on an exercise bike. That may
Okay.
be giving you the same kind of effect. It just we all get tired of staring at the same four walls. So maybe someday when we can't go outdoors because of climate change or what have you, we'll all be living in a virtual reality box and taking vitamin D liquid supplement. I don't know, but there are
Yeah.
ways. There are ways, at least for the times like now when outdoor stuff is limited to still mimic that. It would probably be different if we were in the South, if we were in Texas or something. They have outdoor classrooms going on through the winter at Rice University in Texas. So
Well,
it's under a tent because they can do that. At Pacific University, they took down the tents we had outside for eating lunch and such because nobody wants to be out right now when it's 38 degrees outside.
right. Right. So yeah, and if you can briefly touch upon the ongoing research in this particular area, like what's new in this field? Because I know a lot of people have been talking about blue light and the intrinsic photosensitivity ganglion cells for a really long time, but has there been new studies which has refuted the previous ones? What is new in this field? Like what is
Yeah.
something that a regular person can find out?
Yeah, well, I mentioned briefly there's a three-prong interest in blue light right now, and I think you might remember the founder of the Vision Ergonomics Lab, Dr. Jim Sheedy,
Right.
always said the blue light wasn't really light because the short wavelength photoreceptor in our eye is almost as subconscious as the melatonin, the photosensitive ganglion cell that can
Right.
see the blue light. The short wavelength photoreceptor, the S cone, sees even shorter wavelength, kind of indigo 430 nanometer light. That's pretty close to the violet and ultraviolet end of the spectrum, so it looks very dim to most of us. And he had a point there, but I think the three-pronged approach is the sleeping and waking seasonal affective disorder interest in blue light. That is pretty evidence-based.
Right.
In the middle, there's the digital eye strain interest in blue blockers, and that does not have evidence right now. Now, again, the absence of evidence is not evidence of absence, as they
Right.
say. So it is possible we will discover. I'm not working on it myself, but we'll discover that significant blue blocker lenses that you can see if you hold the glasses up to a white piece of paper, you can see the yellow tint. A
Right.
50% tint or something that is rather cosmetically noticeable. That might have some effect besides just making you fall asleep on time. The Gunnar Optics company, for example, that I've done some research on, they have said for the professional athletes, they're doing intense, making their living sometimes doing video games. That is a better lens for them. Again, I would argue that it's also a lens that would put them to sleep.
Right.
But the research is still pending there. What I think is probably not going to pan out is that the claims that a blue blocking yellow spectacle lens is going to prevent macular degeneration. This is, of course, dry macular degeneration in North America is the leading cause of blindness. And unlike wet macular degeneration, we can't treat it with the new injections of the anti-VEGF, as we call it, the vascular endothelial growth factor medications that the ophthalmologist now can inject into the eye to prevent blood vessel growth. But in the atrophic kind, the dry kind of macular degeneration, we have no treatment other than vitamins and a healthy lifestyle and diet to prevent progression and hopefully to prevent onset of this disease, which is otherwise untreatable. We live to be 100, and are we going to live to be 100 with low vision is the question. So something you're working on, I'm sure, where you are. So I think the blue blockers, they are doing some intraocular lenses after cataract surgery that are yellow tinted. Some surgeons are only using those now, and it was the big invention for a generation ago was when they started blocking ultraviolet light with those intraocular lenses. Now it's ultraviolet and blue, or at least violet light, that they're trying to block, again, to prevent degeneration. That may be a little different than spectacles that have light coming in from the sides, and especially if the tint is not visible on the lenses. I certainly have found that my patients, even if they're effective, even if they are the e-gamer type of e-athletes, they don't like the look of the yellow lenses. And so they wear them alone, and they won't wear them on camera, and they won't wear them around other people. And so that's going to limit the adoption of them.
Right. Okay. And anything else that you want to add about blue light and seasonal affective disorder, or any tips, because we're going to move to the next topic.
Yeah.
Before that,
I think just in closing, we should remember there's a moderation theory here. Blue light is the visible neighbor of ultraviolet, and we now know, although ultraviolet certainly can be blamed when you have too much of it on things like sunburn, skin cancer, cataract development, and even macular degeneration in the light colored part of the population, like myself especially. We need some ultraviolet light for vitamin D development. We need some for preventing bacterial infections, maybe even with contact lenses. People that have ultraviolet blocking contact lenses may get more bacterial eye infections. And so I think probably it may not be all discovered yet, but blue and violet visible light also we need in moderation, and if we ban it all times of the day for all people, we're going to get in trouble. And if we have too much of it, like we do on digital devices, maybe we get in trouble too.
Okay. Yeah. All right. So we move on to the next topic. So let's talk about how our eye's physiology, that is the shape and structure, how the physiology shapes our perception. So the most common question that people ask me is, why are we seeing things that are actually not present? Like, why are we perceiving things that are not exactly right in front of my eyes? And why are we seeing optical illusions? And what are optical illusions, and why do we see them the way we see them? So I thought let's start off with the Entopitic phenomena, which I think you're going to explain. So if you can tell us the difference between Entopitic phenomena, which is basically the eye's physiology, like the things you see that's because of eye's physiology, and the difference between that and optical illusions, and then probably we'll talk about a couple of commonly seen Entopitic phenomena.
Well, when it comes to whether it's entopic phenomena or optical illusions, in particular interest of mine, being a visual perception professor, I think it might have been Goethe, the German philosopher, who really prized. We remember him for his prose now, but he really was more proud of his work in optics. And
Hmm.
he was one, I think, originally said in German that optical illusions are optical truth. And I think that's really what we have to look at. They're telling us something about the function of the eye. I think one of the articles that you sent to me, or was linked to one of the images we'll see later, talked about maybe an NPR story about it, was talking about when you have a color inkjet printer or color laser printer and you run out of one of the types of ink or toner,
Hmm.
then suddenly you become aware of how they're mixing colors to make the image you're trying to print.
Right.
And that is telling you, although it's a dysfunction of your printer in a way, the printer is actually functioning normally. It's just out of its colored ink or toner, and you're seeing the inner workings of how color images are made. So vision is not the same as a printer or camera, but it does, when it fails or when it fools us, whether you have normal vision or low vision, I think it's telling you more about how it's functioning when it's working. And so we
Right.
have to start looking at optical illusions that way, that they're really telling us the function, or maybe dysfunction, if you see that way, is telling us about the structure of the eye and the visual system. So entoptic phenomena are things that ophthalmologists have largely championed as a way to calm their patients who have had surgery or think they need more, to tell them that everything is really okay. For many surgeons, and I need our ophthalmologists. I'm not a surgeon myself, and I greatly respect work with many, but it's kind of a bucket term for a lot of ophthalmologists, of something that the patient, it's a real complaint of theirs, but I can't photograph it most of the time, and
Right.
I need to just give them advice that it's okay, that they're not going blind from this. And
Right.
so they all learn about it in some ways better than optometrists do, because we go after perceptual problems, I think, more than the average surgeon would.
Okay. So let's talk about three of the most commonly seen. Like the first would be, when you rub your eye, when you're waking up first thing in the morning, you rub your eye, and then you see a lot of multicolored lights, or a circular or a star-shaped pattern that's moving in the opposite direction of the way you rub your eye. So why do we see those bright colored lights, and why do we see those patterns? Like I'm not looking at anything. Like I barely open my eyes, but I still see them with no object, or there's no light. So why are we seeing them?
All right, sounds like time for another screen share. This one, I apologize, has some text on it, but there will not be a test on this later. In fact, I even have my Severus Snape on this slide, don't I? This is the way. This is the way I as you know, I tell my students and our students, this is going to be on the test. So,
Right.
so yeah, so you're talking about pressure phosphenes, and it's interesting to note that, as you see in this cartoon, that you can induce light by indirectly increasing the intraocular pressure. And
Right.
this, I don't encourage this, because the eye's delicate, and there's some evidence that constant eye rubbing can contribute to thinning of the cornea and a disease we call keratoconus. And so if you find yourself rubbing your eyes all the time, if they're itchy, you should probably get some allergy medicine, either oral or an eye drop form, to
Right.
prevent constant eye rubbing. But all of us have done the occasional eye rubbing, maybe when we're sleepy, and perhaps notice the sparkles that occur. I
Right.
like to describe this to my patients, and I probably to you, the students as well, when you were in my classes, that the retina cannot really sense pain. So when it's in distress, when it's losing blood flow, when it's having pressure exerted on the cornea, and then through the aqueous and vitreous back to the retina, that all I can say is light, light. That's its way of expressing distress. It happens when you tear the retina, unfortunately, as well. And so the pressure phosphenes are just a sign of distress of the retina, and they can be sort of a pretty light show when it happens on occasion, as this cartoon. But other times they're a sign of that there's some trouble brewing. And in the past, this would be something that you could worry about and not do something about in a couple of generations ago. But now, those that have access to ophthalmologists, and in some places in the US, optometrists that are licensed to use retinal laser treatments, sometimes when phosphenes happen without pressure, that's a necessary thing to get.
Okay, so it's usually normal, but there are certain cases where you see them without any physical stimulation. Okay.
Yeah, so the pressureless phosphine would be a concern. A
Right.
pressure-induced phosphine would be a normal response. If you find yourself rubbing your eyes a lot, then you probably should seek treatment for that. But the pressureless phosphine is usually the concern. I think the most common one of those is from migraine headache about to happen. Uh, and
Right.
in some lucky folks, they just get the aura without the headache. But most who've had migraines know that if you get the aura, you better take medicine or get home where you can lie down, because it's coming and you won't be able to see very well. And certainly if you're driving or even taking public transit, that will be a problem.
Okay, so it's basically that when you put a little pressure, so the mechanical stress on the retina perceives it as light. Is that what you're trying to say?
Yeah, and it's interfering. I mean, it's not just blood flow, but it is that you can cut off again, not a good thing to do on a regular basis, but if you cut off the
Right.
blood flow in the ophthalmic artery, arterioles and capillaries, and the capillaries being very small, it's easy to do that with a little pressure increase. You will certainly have that effect. If anyone has suffered a concussion or any kind of blow, Lord forbid, to the head or eye, we talk about seeing stars, and part of that
Right.
can be the shock wave going through your eye, and it's the same kind of thing.
Like, you watch that in every cartoon where, the main character gets hit and then there's a lot of stars or birds circling around your head.
And it's
So,
somehow funny when you're little and you haven't had it happen to you. Then when you're older and it's happened to you, like, that's terrible.
right.
That's causing
Right.
brain damage. That's not good. So,
And
yeah.
is this similar to what we see, say, when you pass out or when you're about to pass out? You're still conscious, but you know you're going to pass out, and you see all those lights around. So is it the same?
I see this a lot in clinic. There is a phenomenon that's related called visual snow, and
Right.
this static in the vision is something that patients with low blood pressure will experience. And when you're
Right.
experiencing shock, low blood pressure can certainly be something that follows that. And so when the blood is drawn away from the extremities towards the abdomen, as you don't have to be cut and bleeding for this to happen, although some people have it when they give blood.
Okay.
Other people have it when they have a dental procedure done,
Right.
particularly a tooth extraction or something. And your lips will go blue. You might hear tinnitus and buzzing in the ears, and you'll get the staticky vision in your eyes. And some patients don't know how to look that up. You can't Google it if you can't name it, and I often say. And so,
Right.
yeah, the visual snow is sort of a form of entoptic phenomena that happens because of a loss of blood pressure to the head and therefore to the eye.
Right. Like you take an injection, and if there's a lot of pressure, the fear, and you kind of pass out because of that.
Yeah, and I think again the shock response is it's drawing blood away from the arms, the legs, and the head, unfortunately,
Right.
and towards the abdomen to keep the vital organs minus the brain, happy.
Right.
So,
Mm-hmm.
and perhaps because there's pain associated with this, any of us that have broken a bone or something know that if you pass out, it spares you feeling some of that pain. Um,
Right.
so it's probably Mother Nature's way of trying to protect us.
Great. So coming to the second one, again, this is commonly seen. We've seen this, during our childhood, especially. You see small circular, transparent, squiggly shapes. When you're looking at the blue sky, specifically the blue sky, or probably if you keep staring at your screen for a long time, you see those shapes. They keep falling, and then you blink, you lose them, and then after a while, it comes back again. So, what exactly is that like? Like, what are those bubbles, or what
Yeah,
what are those
yeah.
shapes?
The Greek in ancient Greece, they were aware of these, and they called them flitting flies. And
Mm-hmm.
um, was it muscae volatantes? There, of course, we now know them as vitreous floaters, and the vitreous floater effect is well known. I think in my title slide for my Entoptic phenomena, I can share with you the little bit of. Again, I can't take credit, but I'm giving reference to the source here of the GIF file. And so here they've given them eyes and made them look like they're microorganisms, but in fact, of course,
Right.
they're not. Often you need what's called a Gansfeld by the Germans, the brightly lit, solid colored background. Blue sky will do it. The other thing that'll do it in the north is when you get that fresh snowfall and everything's white on the ground, and you will notice the vitreous floaters, which may have been there since you were born. So yeah, this is probably the most commonly observed entoptic phenomenon. I think in optometry school, I had some classmates that weren't aware of their floaters until we studied them in class, and then felt almost, almost, what should I say, bitter that they had been made aware of something they were blissfully ignorant of before. They're hard to photograph. They can be sometimes seen, but they cast a shadow close to the retina, and thus they are easier for the patient to see than for the doctor to see, I would say, as a rule. Here's, I think, one bona fide photograph, if it helps our audience to appreciate with general information about this is kind of, from the doctor's point of view, they're often white, and from a patient point of view, they are dark gray, almost black. And if you're familiar with your floaters, if you can count them, if they're a familiar shape and you've seen them before, they're generally the remnants, which you might have been about to ask me, of the hyaloid artery, the artery that goes between the optic nerve here and the lens of the eye in fetal development before you're born. So they're,
Right.
if you're lucky, they've settled to the bottom, kind of like a snow globe would, that we
Yeah.
see at Christmas time. And if you're not lucky, they hang out in the middle of the vitreous, because the vitreous never circulates throughout life. It may turn more liquid, but whatever debris you have in your vitreous remains throughout life.
So it's basically, I mean, they're actually transparent, but because of the light that passes through them, they cast a shadow, and that is why the patient perceives it to be a little darker, and that's why they see that as, some of them say that it looks like a fly that is,
Yeah,
passing
and
in front of
if
them.
it's new, they'll swat at it. Hopefully, if they've had
Right.
it since childhood, and since birth, it's familiar enough. The brain does a pretty good job at filtering out familiar parts of you if the lighting is normal to low. But when the lighting is brighter than usual, that bright snowfall, or the again, the blue sky, when
Right.
you're in the Northwest, that doesn't happen very often in the winter. Then your brain can't keep up with filtering out this part of your system. I mean, it's the same way the brain filters out the blood vessels that lie on top of the rods and cones of the retina, particularly the cones. They're part of us all the time, and they're usually not visible to us, because the brain basically just cancels them out.
Right. And so are there so technically floaters are something that's normal, like every person can see it. Some of them can appreciate it better, I guess, depending on how well you observe. But are there any conditions, where seeing floaters is pretty alarming and they have to go to a doctor to get that addressed?
Yeah, this is not an uncommon question for people to get, even at the front desk of an eye doctor's office, where they're called up by folks who patients that are worried about seeing a floater, and it happens more on a snowy day or out here a sunny day, that it hasn't happened in a while. But one of the things the front desk folks have to learn, and certainly the doctors should know, is that if they are a finite number of familiar floaters, then they're usually of little concern. If they are a new floaters of any number, or a uncountable number, I describe it to my patients as someone shook a pepper shaker in your eye, and you can't count the pepper flakes. There are too many, and so, or a swarm of gnats. There are so many that you haven't seen it before. Then undoubtedly, that is probably new and a sign of the retina in distress. It can be a blood vessel bleed. A small capillary leak can cause red blood cells to leak into the vitreous,
Right.
and those will be seen. Or it could be a retinal tear. The dark spots that can be pieces of retina that have torn off. Either if you're lucky, it's what they call a horseshoe tear, that's just shaped in a U shape and can be tacked down with a laser. And if you're less lucky, it's a longer tear than that may require a scleral buckle and going under anesthesia to have it tended to. Sometimes with more than one ophthalmologist working on you at the same time.
Right. So if there's a sudden onset, then that means there is an underlying pathology which is
Yeah,
caused this
that's
condition.
usually the concern. And a small blood vessel leak can easily be fixed, again, with a laser these days as outpatient. Your street clothes, you're awake, you maybe given some numbing drops. It's kind of bright, the light is
Right.
almost painfully bright, but that's all. And then you'll be given some anti-inflammatory drops afterwards, and monitored to see, maybe they'll do some blood work to see if you have an anemia or something that would keep you from clotting. Some
Right.
people get those kind of things after they lift a heavy object or do some other Valsalva maneuver where it increases the intracranial pressure. And so that can be avoided. We all know you can get a bloodshot eye if you're scuba diving or that kind of thing, and you change pressure too fast
Right.
when coming up to the surface.
Or like holding your breath for long
Yeah,
periods of
yeah,
time.
any of that kind of bearing down, some weight bearing exercise, resistance bands. You know, I tell my patients that have this happen, you see, exercise is bad for your health. You
Yeah,
should
well,
avoid that.
yeah, I think we shouldn't advocate something like that.
I hope everyone knows that I'm kidding, but
Yep,
there are
yep,
certain
sure.
forms that the patients that get hit in the eye with the exercise band, that
Right,
I
right,
do encourage them to adopt a different form of exercise. And
right,
there's some evidence that those weight bearing isotonic exercises are bad for eye pressure and may increase risk of glaucoma as well. So, you know, riding the exercise bike indoors, perfectly safe for the average person if you're not super clumsy, you know, but other
right.
things maybe less safe than we think.
All right. And you know, how was this? How are floaters different from the blue shear phenomenon? You see those small dots.
Yeah,
Um,
this is less well known, I think, but seen by folks. And I just hate to have people going into an eye doctor or otherwise who complain of something and then are accused of being crazy. So I like to let patients know about this. And this is for those athletes out there that like to get their heart beating. The so-called blue field phenomenon or Shearer phenomenon is this is a computer simulation. It's a little harder to see on this side, but
right,
it's actually when you are seeing your retinal vasculature under normal healthy conditions. The white blood cells are large enough in a capillary to sometimes cause a traffic jam, and the red blood cells will line up behind them. And as they move through the retinal vasculature with your heartbeat, which will be, of course, increased if you're exercising, and if you're running outside or riding a bike outside and you have the blue sky, or if you're maybe taking a jog in the snow, that you will see against that Gansfeld, you will see sometimes the white blood cells racing through the retinal vasculature, and it can be a little disturbing, but this is a sign of a pretty healthy retina.
okay,
I can't think of a case where this would be bad for you, but it is a little disturbing to the patient to have this go on and have it go on more with exercise, maybe with heat and that sort of thing. When you take a hot shower, if the shower walls are very white, you might see that increase your blood rate as well, and that would cause you to see the shear phenomenon. So it's that one is less worrisome, and unlike you can actually tell sometimes this from visual snow, sometimes by looking to see which one you're seeing at night with your eyes closed. Um,
right,
so the blood flow, the low blood pressure causing the visual snow and static in the vision is different than the racing heartbeat and the blood pressure from exercising that you would get for the shear phenomenon. So
right.
disappearing with your eyes closed can be a sign of whether this is one or the other. But one is a high blood pressure effect and one is a low blood pressure effect. I think that's another way to look at it.
So it's basically whatever you're seeing, all the white dots that you're seeing is the white blood cells that are going through the capillaries. You're basically seeing the light that is coming through them. Is that
Yeah. The white
correct?
blood cell can reflect the light. The red blood cells backed up behind it absorb the light, and
Right,
so you might even see a dark tail behind the white the white feature. But
right. Yeah.
they're mostly young, healthy patients that I've known that experience this and are able to report it to me. And they'll kind of ask the question shyly at the end of the exam. Maybe they're noticing a little with the dilated eye, and me shining lights in there.
Okay.
Yeah,
Right.
they're like, I know this sounds crazy, but should I be worried? And the doctor can't see it or photograph it at all, at least with current technology. There might be,
Right.
we get to swept source optical coherence tomography in the future. Maybe we'll be able to actually to show it live, to document it.
All right. And so blue shear definitely is a very normal phenomena when compared to probably the floaters that we just discussed. Although floaters are also normal, except in cases where you see them with a sudden onset, I guess, right?
Yeah, too many floaters or new floaters are not normal,
Right.
and shearer would be, at least among patients who get their heart rate going, would be a more normal thing to see.
All right. All right, so we're on to a final topic of discussion, and I thought let's have some fun with optical illusions. I put together a couple of illusions that are, a lot of people have shared on social media, and everybody was pretty anxious, or they were curious to know why exactly, like why are we seeing this? And I've also added one of the most commonly circulated or the most confused image, the dress that, whether it's gold or blue. We did have a long discussion, and a lot of news channels were also talking about that, which is great. I mean, people talking about science, and people were trying to explain the science behind it. So it's definitely good. So I thought we'd talk about a couple of commonly shared optical illusions, and why do we see them the way we see them, and probably discuss some trivia behind that.
This is where you get to share your screen.
Yep. Let me just pull the presentation up.
I must say, it was probably optical illusions that I spent my first year as an assistant professor studying, and I hope I can do them justice. But I think it's probably what brought me out of private practice and into being a part-time clinician and a full-time professor, because I think this stuff is endlessly fascinating. If I ever have the opportunity to talk to very young kids,
Right.
like my kids' school, this for me is much better than bringing in a dissected eyeball.
I know. Yeah.
This is about vision, not about the structures necessarily.
Right.
The structures follow the function, but everybody likes the function more than the structures, I think.
Yes, I mean, it's good to know the structures, but it's always good to know the physiology, the functions, and what exactly or why exactly it is the way it is.
Yes.
All right, so let's start with the first one. So we all know that it's stationary, but it is giving us the illusion of motion. So what is that is giving us the illusion of motion? Like, you see the wheels, there are lines, there are black, gray, and white lines, and that is giving us the illusion of motion. So what is causing this effect, and what is the name of this effect?
Yeah, so this is interesting. There's of course a light gradient that is causing this, and this was the OptArt, or kind of a jazzy type of scintillation that was very popular in the U.S. starting in the 70s and moved forward. In general, this is, I think, now known as the rotating snake illusion.
I have that. Yeah, I have that. That's the next one.
Yeah, that's going to be a color one that we're going to see.
Yep.
They're generally called a peripheral drift, is I think the general name of this. And so with motion illusions, physiologically, there are two places in the visual system that you'd want to look. I think some of the ones we're going to talk about today are cortical, or in the brain. This one, I would argue, is more of a retinal effect. Now, your brain is needed to interpret it and such. Your retina sends back information as loyally as it can to the brain, but the job of the retina is to pre-process some of the information. It's sort of the way an Amazon warehouse would pre-sort things by zip code or what have you, by QR code, in order to get them to where they belong quickly. So the retina is doing the kind of grunt work that an Amazon warehouse worker might be doing to get things quickly sorted, so that the brain can do the more sophisticated work of interpreting the image and what it means, and whether we have to get out of the way of something. Is this coming towards us, for example? Is it a ball flying at our face? So I think this is retinal motion that we're seeing here. And the light gradient is showing us indirectly, again, optical illusions are optical truth, right? So we're seeing, because we just have three simple colors on here, we have white, black, and gray, we're trying to access, or we're inadvertently accessing the different channels of information that are being sent from the retina to the visual cortex. In humans, the eyes would have to be very huge to do all the information processing that we need to survive in the modern world. And if we were a simpler critter, like a bird or a lizard or something, we might not have much of a visual cortex, and we could put all the information processing in the retina. But in humans, the retina does the pre-processing, and the visual cortex does the rest. I think this is all retinal. And what's happening is we have a luminance channel that I think you learned about with me at some point. The luminance channel is processing light versus dark versus in between. And we have a contrast channel, which is processing, the black and white contrast versus the shades of gray. And they work at different speeds. I think we all it's a common sense thing to know that the luminance channel, our so-called photopic or daytime vision with our cone photoreceptors, at least our long and medium wavelength cone photoreceptors, is a faster channel. We're diurnal creatures. We operate better in lighted conditions, and we see faster in lighted conditions. So the bright parts of these images are seen faster. They get to the cortex faster. They're processed faster than the dark parts. The border between the two is where things get interesting, whether it's the gray border or the black and white transition sort of Terminator line. That border is you have retinal cells that are adjacent to each other, starting with what we call the horizontal cells of the retina that are talking to the different photoreceptors, and moving to the bipolar cells, which are in between the photoreceptors and the ganglions, cells that take information out of the eye. Those cells are saying, they're arguing with each other. They're saying, I see light. And the neighbor says, but I see dark. Who's right? And the peer pressure that we call lateral inhibition causes them to come to some sort of compromise over that when they can. And the compromise might be inducing, saying, okay, probably what's happening is we have a moving light gradient or a moving pixel across the retina that is bright, and it's going on a dark field. And they interpret that therefore there's a little bit of wiggling motion that must be why they're both right. One is seeing dark and one is seeing light. It must be a moving target. And so that's at a very primitive retinal level. And that's why it's very hard to overcome the little bit of wiggle or jazzing you see on this picture, because it's not your cortex is seeing it. You can't use your brain to convince the other part of your brain that it's mistaken. It's your retina, which is so early in the processing that the cortex continually gets the signal. This is a moving light across the retina.
Oh, so you mean to say, although they're stationary, the different contrasts are sending out different signals, and the brain's trying to process that, and that's why we perceive it as motion.
And they're out of stationary. They're out of sync. The dark signals where we process dark images as we do in dim lighting more slowly. When you're looking for when the lights are off or it's late at night, or maybe someone's asleep in the room like my kid is, and I go in there looking for my phone, and he's asleep. I don't want to turn on the lights. And so I can't use my phone flashlight because I'm looking for my phone. So I'm processing more slowly the dim images. Where is my red phone case on the red blanket, and it's, and so that out of sync signal is getting to the visual cortex in different times, but it's also being processed at different speeds on the retina. So the different channels for dark and light are out of sync, causing a motion perception.
And so the rotatory snake, I think it's the same concept, but with a lot of colors involved. If you can highlight that.
And this is fascinating too, because when you're supposed to be fixating naturally, I think we're drawn to the black kind of diamond oval in the center of each of these rotating snakes. This is by Kitaoka, who was the originator in Japan, I think in 2003. And one of the first illusions that I don't think I had seen, it was early in internet days when I was starting teaching in 2005, but I don't think I'd seen this till I started to study for teaching visual perception. What you notice when you're fixating on any of the black, I guess they're looking closely, they're more circular, in the center of these, each snake, is you're seeing in your peripheral vision, you're seeing some motion, and sometimes it's clockwise and sometimes it's counterclockwise. But if you stare, it kind of brings it all to a grinding halt. And then when there's a movement of the eyes that's required to keep the targets moving. And I think what we're seeing here, we are seeing a light gradient. We're seeing there's a black and white if you look carefully, and then there's a yellow next to the white, in between the white and the black, and then there's a blue in between the white and the other white and black. And the yellow and blue only touch each other on adjacent circles, but not within the same circle. So we have two gradients, I think, going on here. We have the brightness gradient we saw in the previous peripheral motion illusions, and we're having a color gradient as well. And now I think although this illusion can happen in grayscale, we're seeing also the processing speed between that short wavelength cone, which is a more primitive cone than our medium and long wavelength cone that sees the yellow better. And the difference in processing speeds in this chromaticity channel is partially responsible for these circles seeming to move, particularly when we move our eyes and refresh the retinal image. It's a short-lived thing. It's a phasic kind of effect rather than a tonic effect. And of course it is subtle, although I think for me, this is more dramatic than the previous ones. And I think Kitaoka played a role in the previous slide image on the right. But he basically, by understanding the way these gradients were working, he was able to make them more dramatic by adding color or adding multiple rings. You might notice that the direction is always kind of consistent with regard to the color. I think we generally see it moves black towards blue and from white towards yellow. So you can predict whether the circle will seem to move in a clockwise or counterclockwise direction based on that. And again, I think that's predicting the consistent processing speed of the retina, where we see yellow faster than we see blue. We process white faster than we process black. And so that's really interesting to look at this in more detail. And you can imagine if you were in psychology, you could probably do a whole dissertation on this for a PhD, as Hida Oka and colleagues may have done. So yeah, this really does tell us more about the functioning, I think, of the way the retina is supposed to work. And you can see, I think if you follow that link, you can see the grayscale version of it as well, which is still functional, but maybe not quite as dramatic to me.
So it's basically how fast the eye sees the color. So that's again, like in the previous image, we saw that the gray is perceived slower than a white or a black, and similarly, we, as you mentioned, we have yellowish green, and then we have blue. So these are perceived at different speeds, and that is again, causing the illusion of motion.
And it predicts some things about the anatomy of the retina that you could then confirm. For example, we have more medium and long wavelength cone photoreceptors than we do short ones. Of the 6 million cones in the healthy retina, maybe 5 million are medium and long wavelength, and less than 1 million are the short wavelength ones. So they have an advantage. They have I probably said in class when you were my student, they have a broadband connection, whereas the poor S cone has got a rather slow connection, almost a dial-up connection to the visual cortex. It's a little more tricky when you get to the rods versus the cones. The rods wouldn't be active in any kind of room lighting conditions or looking at a white background PowerPoint slide. But if you were comparing our truly starlight vision to our daytime vision, the rods do outnumber the cones 20-1. But they still they don't have a broadband connection. They have a slow access to the internet brain. So we do, again, that gives you some predictions of how the structure is going to look.
I think for our viewers, without getting much into detail, if you can tell us what are long wavelengths, what are short wavelengths, what are medium wavelengths, and specifically what colors contribute to these wavelengths, just briefly.
Yeah, I mean, even with the inkjet or colored laser printer analogy, we know that those printers, they use trichromatic ink or toner to make their images, and it's not the RGB that we used to use on cathode ray tube monitors and TVs in the past. Instead, it's often cyan, yellow, and magenta, I think, are the three colors they use for mixing true colors. But the retina works on sort of that principle. There is the short wavelength cone is often called the blue cone, although it's really more of an indigo, I think, in the 430 nanometer range. The medium wavelength cone is a nice, true kind of Kelly green, I would call it, in the 530 nanometer range, 100 nanometers longer. And the most populous cone in the retina, and particularly in the center of our vision, is the long wavelength cone. But surprisingly, it is not found at the red wavelengths or even orange. It's at the yellow end of green at about 560 nanometers. And most of us have more of these L long wavelength cones than we do the others. And so we're still able to mix a yellow and a red later in the retina at the ganglion cell layer. But we really have three primary colors at our photoreceptors, and two of them are in the green. And if we include the rods as a fourth one, they're also in the green, although the rods aren't capable of appreciating it as much. So it's fascinating to look at how we can see the rainbow that we see when we don't really have a red photoreceptor or an orange photoreceptor.
Right. Moving on to the next one. So this is, we see this pretty common when looking at a ceiling fan or the propeller of a helicopter. We see that the wheel's going in the clockwise direction, and at a certain speed, it moves in the counterclockwise or the anti-clockwise direction. So what is this wagon wheel effect, and why do we see that?
I think it gets its name from when in the US, in Hollywood, Western movies were super popular. And so all the movie stars in Hollywood back in the 50s and 60s, they had their own horse that they would ride in different Western movies. And they, and they would have, of course, all these wagons that would, when it was combined with the frame refresh rate of movie cameras at 24 frames a second, the movie viewers would see what looked like the wagon wheels clearly moving in the opposite direction of the wagon. And you can still see this with cars, sometimes in real life, but certainly with a cell phone camera or the propeller, like you say, since we're allowed to use it when we fly again from takeoff to landing. If you're sitting in the window seat or at the wing like I do, you can with the refresh rate of a camera, it's very visible, and you'll see what appears to turn backwards. I think we've also seen this for those that have watched gambling movies or been to Las Vegas or something. You've seen on roulette
The
wheels.
roulette, yeah.
Yeah. And the key there, again, is that there's a refresh rate of our cameras, whether they're analog, 24 frames a second, or digital, but there's also a refresh rate of the retina and the cortex. And here we're starting to get into whether motion perception is going beyond the eye. The edges, I think, are still seen by these horizontal and bipolar cells in the eye, but the motion itself is seen, I think, cortically in the brain, in the visual cortex. And when you see a reverse motion, there are a couple theories that are often used to try to describe why this occurs. And the cortical theory is that there's simply a refresh rate to our visual cortex that is finite. And if the wheel is spinning at twice that refresh rate, then maybe it will, or exactly that refresh rate, it'll appear not to be moving at all. And if it's spinning at a fraction of 1.5 times or 2.5 times that refresh rate, there may be competing explanations in the brain. Is the wheel moving forward or is it moving backward based on every time that again, the eye is not exactly a camera, but we sort of take an image, send it back at a very fast rate, probably at about 80 milliseconds is each frame. So you're looking at about, 12.5 hertz is the kind of rate per second, cycles per second that you're looking at the speed of sight for a healthy eye. And so when you have that, if the rate of spin from the spoke moving from one image to the next, it looks more consistent with backwards motion, that's how the cortex is going to interpret it. Or if it's consistent with no motion, it's going to interpret it as just a strobing effect. Really, all motion is seen as a form of flicker. And this is showing us how it's flicker across the retina that gets interpreted by the brain as motion, and it's based on a finite refresh rate. There was a great demo when I was a student, and we used to use slide projectors. Professor Cool, may he rest in peace, he showed a slide projector image, and he focused it in the middle of the air rather than on the screen, so you couldn't see what it was on the wall. And then in the middle of the air, he took like a yard or meter stick, and he waved it fast where the image was focused. And what you would see was an after image of like a tiger. It was clear as day because the rate he was swinging the meter stick was faster than the retinal refresh rate. And it was as if a screen was hanging there when the image was in focus. And that really demonstrated how the retina does have this finite rate, just like a camera does.
All right. So it's because of the refresh rate of the retina, there's an internal dialogue going on as to whether it's forward or backward, and the brain interprets it as. So are you saying that the brain is interpreting the signals that is being conveyed by retina, or is it? Let me just rephrase this. I think I'm not putting it more eloquently. So the retina is just transferring the information that the eyes are seeing to the brain, and we know that the brain is processing it. So is the brain processing the correct information that it is going forward, or we see this particular effect because the brain is confused? So can you explain that?
Yeah, you're actually getting at kind of the two theories. First, we should, one thing I always have trouble impressing upon everyone in visual perception is that the old name of the course used to be visual information processing, because even though the retina is not as clever as the brain, it's still processing the image. And that's why all the optical illusions we talked about previously, the rotating snake and such, happen. If the retina was just relaying what it was seeing, we get no motion perception for those things in the brain. But the retina does try to process the image to make the brain's job easier. And in this case, there's the retina is sending every 80 milliseconds, sending it the collected image of the wagon wheel to the cortex, to the visual cortex. And if the cortex can't make sense because of its refresh rate, then there's what's sometimes called perceptual rivalry, where you have, okay, I know the image in my frontal lobe, where I do have my memory and such, I know the image, the wheel should be moving a certain direction because the car or the wagon or whatever is moving that direction, the roulette wheel. But my cortex is telling me it's moving backwards now. And so how can that possibly be? And that's then the cortex, maybe with working with the frontal lobe, has to make a decision. And often when we see the illusion, it's because the frontal lobe can't overrule the visual cortex. It's nope, it's moving backwards, even though you never saw it changing. It's only getting faster and faster, but it's moving backwards now. And I think, it's these days we have some American cars, at least with the rotating rims. And so when they're moving on the highway, you don't actually know, which way the tire is moving, but you don't know which way the rim is moving. And that plays with the effect even more.
All right. The next one, this is the waterfall illusion. Let me see if I can play the video properly. I think I'd probably explain this to the viewer. So you're supposed to keep, I'm sorry about that. All right. So you are supposed to focus on the center of the screen, that is the blue and the white dot in the blue background. And you keep staring at that for a minute or for about 50, 60 seconds. And then what happens is when you look at another image, or the image starts, becoming bigger, or so you see an invert circle going around, and when you shift your eyes to the other image after the 50, 60 seconds of viewing this one, you see that it's going in the opposite direction. You see a motion, or you see a swelling sort of an effect on the other image. So that's, I think, called as the motion after effect, or the waterfall illusion. And if you can explain why we see that.
This is definitely considered to be cortical, but it comes across, so it's in the surface of the brain, in the visual cortex, and in an area that we call the middle temporal area, or in a monkey that would be area B5. What you're happening is, again, you have the light gradient traveling at different speeds across the retina, but there's definitely that is on this 2D illusion what's giving us the sense that it's going down the drain, or that kind of thing going, it's almost the peripheral vision is getting, if you make this big enough, or on a big projector screen, or you get close enough to it, it'll give you the illusion of what's called vection, where the middle temporal area is seeing as if you're going through a tunnel, and you're getting large peripheral vision moving past you. So it's interesting to note, again, if the structure is predicting the function, where is this occurring? So I said middle temporal, but how is it getting there? And then why do we get the after effect when we look at a still image? So here's where the retinal information does have one synapse of the neurons, of the ganglion cells, before they reach the visual cortex. And that's in the lateral geniculate nuclei of the thalamus. And what I teach in my classes is that, as I was taught by my predecessor, Dr. Bob Yolton, the thalamus works as a valve, that it has about 1 million inputs from either eye on each of the lateral geniculate nuclei that are coming forward, if you will, from the eye, but it has about 4 million inputs from the visual cortex. And they're saying, okay, if we're going through a tunnel, then we can copy and paste this visual motion information indefinitely until things change, and not waste the cortex time with repeated information that looks like it's going to hypnotize you and put you to sleep. And so I don't know how much I emphasize this in class, but it's not quite a linear pathway between the lateral geniculate in the thalamus to the primary visual cortex. There are some fibers that go directly to the middle temporal area for things just like this, for peripheral motion detection. And then if the image stops, or if you look at a still image, like the waterfall illusion, you're supposed to watch the water falling down as you would here, like in Oregon at Multnomah Falls. And then after 30 seconds, when you've habituated the retina and the lateral geniculate of the thalamus to do a copy and paste, you look over at the mossy rocks to the side. And instead of appearing to move downward, the middle temporal area will tell, by way of the thalamus, will tell the cortex that we must be seeing upward motion of the rocks and the moss. And it, as I've described before, I think in class, it will look like a green fuzzy worm. The cliff will be climbing up the mountain. And it works on most everybody with normal vision if you look at the waterfall long enough. So in that case, what you have is the thalamus is supposedly saving the cortex from nonsense information. But when the cortex does its normal thing and is a little lazy and copies and pastes motion information for a few seconds, you can get a motion after image that is coming from the middle temporal area beyond the cortex, telling the cortex false information.
So why is that we see it in the, so you're saying that, when you're looking at something for long periods of time, the brain or the retina doesn't want to work, it's simply copy pasting. But when you look at something else, why isn't it in the same direction, and why is it going in the other way? Why is it going in the opposite direction?
Yeah, so when you look over, from the waterfall to the mossy cliff, it is of course stationary,
Right.
and the retina is still going to copy and paste for another few seconds,
Mhm.
independent in part on how long you were staring at the waterfall. And so, and it kind of wakes up at some point and realizes it needs to stop doing that after
Right.
a long period of time. When it's actually stationary, in order to copy and paste downward motion, to cancel out the downward motion that's being copy and pasted, you have to perceive upward motion at the exact same velocity and the opposite
Okay.
direction, and then that cancels to become stationary things on the retina. So
All
the
right.
retina is always reporting the truth. The cortex's interpretation of it is mistaken because it got lazy and started to do an automated repeat. You see this
Right.
sometimes when driving as well. If you're driving on a long straight road, and I suppose public transit will work the same. If you're looking out the window or you're looking out the windshield, and maybe there are bushes or trees moving past you at a certain rate, and then suddenly you come across a stoplight, everything seems to drift forward and you stomp on the brake because you think the car is drifting back. But
Right.
it's the same kind of effect from a long peripheral vection motion in the retina.
Yeah, that's the next thing that we're talking about. Like, when especially people who've traveled by trains must have seen this quite often. Like your train is stationary, but then when there are one or two trains on either side and they are going, when they start, you feel like you're in motion, although you're stationary. So why is that? Is it the same thing, or?
Yeah, I think peripheral vision and vection would are really necessary for our survival. Patients with low vision, we talked about macular degeneration and such before. They've lost their central vision, and as devastating that is to reading and to driving, it allows you to still survive in the world by seeing your peripheral vision and being able to navigate. But peripheral vision it evolved before trains and
Right.
motor vehicles and things, and so it's always true if you're not on a motor vehicle or a train that if you have vection in the periphery that you're moving a certain direction. And I don't think our peripheral vision, as primitive as it is, existing what I did call our and others have called our lizard brain, it's something that even animals that don't have the visual acuity to see 2020, they have peripheral vision like this too. And
Right.
for that world, that is the truth that you need for survival. It keeps you from falling off a cliff and such. And so, yeah, I think that is part of the effect. There is also an eye movement effect, which is very primitive. There's an optokinetic eye movement, which was originally called railroad nystagmus, as I think it was observed probably by Purkinje in the West, and maybe others in the East. Was observed that people riding on a train would have a pursuit eye movement that would then follow by a fixed saccade in the other direction. And there's an optokinetic after nystagmus that occurs when then that motion stops and the eyes will drift the other way. And so that, I think, contributes to the sense of vection that we get when we have large objects in our periphery. They're working on a different information stream. The peripheral vision is not particularly good at seeing the red color of this train
Detail.
unless it's large. Yeah, and it can't obviously read anything in any detail, but it's great at seeing motion, even at low contrast. And so that information stream is just it's a minority of our retina, but it operates at and our cortex for that matter, but it operates at a subconscious level, and it's hard to overrule.
All right. And I think, yeah, this is the last one, the dress. Um, all right. So, yeah, is the dress black or blue, or white? Sorry, black and blue, or white and gold? Why is there a confusion? And why is that some of them perceived it as blue and black, and while the others perceived it as white and gold?
I remember when this came out, I think it was 2015, and
Mhm.
I was driving to the university and my phone was absolutely blowing up, and I was doing my best not to touch or look at it, but it
Yeah.
was so bad that I thought there had been some emergency,
Mhm. It's a
and
dress emergency, so yeah.
yeah, it was. I mean, there were news stations calling me, and it was a crazy day. And then it disappeared almost as quickly as it happened. I don't know how many of our students these days even remember or care as much as I think they should. I think the social phenomenon, this is called the social illusion by people like Michael Bach, to whom I owe an enormous debt. I really encourage all your viewers to go to the Michael Bach Optical Illusions website.
Yes.
He's a German professor who I've heard lecture.
I'll put up that link. I'll probably put up that link on the.
Yeah, he's fabulous. He does a lot of the same research in retinal size images and optical illusions that I do. Although I don't think he's an optometrist, but he's brilliant and funny. And so this social illusion, because we got in fights with our loved ones and our family over the truth of this, and then the dedicated investigative reporters went and found the dress, and I think they discovered it was in fact blue and black. But that maybe the reason I never made it onto the local news station, despite the interviews, is because it's like, this is like the spoon in the Matrix. That there is no spoon. As far as I'm concerned, there is no dress, and it really doesn't matter what the original dress is. To me, it looks yellow and gold, but maybe that's because it resembles a costume I once wore in a play version of Antigone long ago. But I think the important thing is, this is like what happens when we read a hard copy book or a Kindle Paperwhite under sunlight, and then indoors, and then at night. We have adjusted to know that the e-ink or the real ink is black and the background is white. And we aren't thrown one bit about the color of those objects, the color constancy under different lighting, even though with a light meter, the contrast and everything has changed radically. So we make an assumption about the lighting all the time. And it's such a subconscious assumption because it's at the retinal level that we cannot overrule it with our cortex. And if you make the assumption that the original picture of the dress here on the left is done under dim lighting, you will see what you see on the far right picture, that it is in fact gold and white, because you would adjust the light level out and that's what you see. But if you make the assumption that it's done under normal lighting, that will change what your retina sees. And they're very hard to overrule those primitive neurons. Primitive but sophisticated neurons of the retina, because they are giving the primary data over and over again every 80 milliseconds to the cortex. And your frontal lobe just can't, despite your logical, thinking brain, it can't overcome. I think it happens even in the presence of the dress under dim lighting. And there have been different, I think, sneaker kind of shoe illusions that have come out about green. Are they green and white, or lime green and pink? Right. We've seen online as well. I think even when you make a digital version of this, you cut out a picture and you drag it over to the other side, it's still very hard to convince yourself you're not being fooled by your computer. So everything is relative to the background. What we're seeing here is what's important to our eye and to our visual system for survival is not the color of the dress, it's the contrast. Because if this weren't a dress, if this were a tree branch or a cliff edge or a set of stairs going down to the basement at night, we don't want to fall or get hurt or get hit in the head. And so the lighting matters less than the colors than the contrast do. Color is important for the modern society. And it might be important for survival of some simpler species, as far as, eating ripe fruit and that sort of thing. Maybe not eating a poisonous caterpillar if you're a bird. But it's not necessary for moving through the world. You can have a very poor color vision, as we know from the large percentage, particularly the male population that is born with color blindness, that you can have poor color perception and do quite well. So I think that's what's going on here. We should be more agnostic towards what we see with regard to color, and less towards more primitive but more important things to our eyes, like contrast.
So when you're talking about contrast, are you talking about the contrast, the background contrast, or the contrast of the dress, or the light?
I think I'm talking about all of those things. When I look at this, it's sort of try to imagine being a retinal cell. What matters to me as a retinal cell is the edge of the dress, where it meets the backlit or floor or wall behind it. The stripes on the dress do matter in terms of contrast. No one disagrees that there are stripes on the dress. You'd have to have low vision, to not see the stripes, right? We all agree there are stripes. Right. And if you think about it in terms of cone photoreceptors, okay, so are we looking at, if you see the dress as gold and white, you're looking at the long wavelength cone that's very happy with the gold yellow color. and the white, which is making the luminance channel happy. Both of those are fast transmitting channels, as we said before, to the cortex. Or are you assuming this is an S-cone kind of thing? If we're under dim lighting and we're seeing a kind of a blue background and black, that's the slower channels.
Right.
So I might argue, being a gold and white seer, that I'm seeing it faster than you are if you're seeing it as blue and black. But but we still can't overrule that. Are we using our fast, our kind of parvo channel? Or are we using our conio channel to see the coniocellular system, the kind of middle system, to see it? We're not seeing this, of course. If we were to do this under starlight conditions, then the color would be gone. And frankly, the contrast might be largely gone. And, so if this were something that wasn't made of cloth and soft, that we're looking to not run into a person under starlight conditions, the stripes might not even help us, But yeah, I think, I think in this picture you have on the right, the middle two stripes of the gold and white dress under blue lighting and the blue and black dress under yellow lighting, those are supposed to be exactly the same. And even then, except for the background, even then, it's very hard to convince yourself, just looking at the half of the dress towards the middle, that they are exactly the same. Yeah.
So this appears a little with a blue tint, whereas this one's pretty much in the white spectrum. To add to that, like, I understand what you're trying to say. So if I take the dress physically and view it and in different backgrounds, like a bright background or a dark background or a medium background, so definitely I'm going to perceive it differently. Whereas this is just a photograph of the dress, which is, like, everybody is seeing the same photograph in the same background, and yet it was perceived differently. So why is that? Like, this is not a physical dress, but it's a photograph.
Right. That's I don't know why. I think probably to teach visual perception, you have to be more comfortable with areas of so-called gray. That maybe a lot of us think photographs don't lie. We're sort of absolutists about that, and that's why optical illusions fascinate and frustrate us. And this is one, but we can't accept that we're making an assumption that may or may not be true. And even if you're told by the investigative reporter this is in fact a blue and black dress, you can't convince yourself, if you're seeing white and gold, as I do, that's truth. But you can, I think, I'm fairly comfortable with a little more type B personality than the average scientist to accept that, be agnostic about it. I was told once by one of the many influences in my life was probably an art teacher in middle school and junior high, they called it at the time, and she presented that color doesn't exist in the dark, and that if I was wearing, I think, a colorful sweater that day, as people did at the time, and she said, if you go into a dark closet, turn off the light, close the door, that sweater is colorful. And I was, as a very type A person at the time, I wanted to argue with her that if we did a dark chemistry experiment of the pigments in the threads of my sweater, we would find them still to be there, But her argument was the color is entirely made of light and our perception of it, and that can't exist in the absence of light. And she was right. It's a heady thing, but the extension of that is that the interpretation of color depends on your assumption about the light, and it only it is absolutely a gold and white dress if you're assuming it's under blue lighting, and it is absolutely a blue and black dress if it's under yellow lighting. And that's the end of the story, and it is both, and it's Heisenberg's dress, it is both, it is neither. And you can't know until you have the dress in your hand under full spectrum lighting and maybe have a frontal lobe that's flexible that what is true, and maybe you shouldn't care, that's what I would argue. It's fun to argue with family and to be convinced that you must be right, but we should be a little, I think, about, I've been talking a lot about evolution and Darwinism here, but here, if you're a little bit spiritual, we can't replace the retina. We can't even really replace the vitreous, even though we know everything that's in it. Right. And maybe we shouldn't be playing God so much with these things, and we should accept that there are unknowns in the universe that are beyond our complete understanding, and we have to embrace that as the truth.
Right. Yeah. Well, I think more the unknown, the more curious we get, and it just gives us more room to explore new things. Definitely. So on that note, I think we had a very robust discussion on a couple of topics, starting with blue light and, the different hormones or the different substances in our body, and how light is important, or sometimes light is not important as much as we thought, in a few where, like the summer SAD, the seasonal affective disorder for during summer. So and the effect of blue light on our sleeping pattern, and how we could use when and when not to use blue blockers. And also it was great to talk about the pressure phosphenes, the other entoptic phenomena. Like it's confusing because sometimes because we see something out of ordinary, we think it's abnormal, but it's just normal. And of course, optical illusions are always fun to discuss, and I definitely had a lot more, but just to keep it under the under our recording time, I thought let's discuss something that's commonly seen and people are aware, or because if they've seen it on social media. So I thought let's discuss the science behind that, and bring it out there. So thank you very much, Dr. Kundart. It was great talking to you. And I will put up your social media account if there's any, so that if anyone has a doubt or if they have a question, they can get in touch with you. And yeah, you could probably share your science with them.
I appreciate the invitation and the opportunity today. I also appreciate the audience's tolerance of this verbose professor, and I guess we're all slaves to our neurotransmitters,
Yes.
And I hope we've woken up some new ones today among the people that have made it this far.
All right. Thank you very much. And so please like, share, and subscribe to this channel. As always, we have very interesting information and content coming up. So keep watching and keep being curious, and keep finding answers to your questions. Thank you, and see you very soon.
It's not rocket science.